Welcome. I am honored that you decided to spend a few minutes of your valuable time with me. Today's episode is very timely because wound and ulcer management physicians and QHPs have been waiting since July to learn how the original Medicare fee-for-service program will pay for their services in 2026, and particularly how it will pay them for cellular and/or tissue-based products for skin wounds, whose acronym is CTP. Now, when I've been asked about the 2026 Medicare payment rates, I always reminded the professionals that we will not know until the MPFS final rule is released. Now, even though the MPFS payment system has been in place for more than 3 decades, there are physicians and QHPs who do not realize that the MPFS is only the end product of the MPFS final rule. In fact, many professionals have asked me, what is the MPFS final rule? And is it the same as the Medicare Physician Fee Schedule? Before I answer that question, I'm going to remind you about the payment disclaimer that I must share with you. When I give you information about Medicare payment, it's provided as a courtesy, but I can't guarantee you or warrant that you're going to get paid or keep your payment. The information that I'm providing you today is current as of November 7th, but of course, it is subject to change. And it's up to all wound and ulcer management professionals to obtain the current payment system information from each of their payers. Also going to remind you, we're going to be talking about the current procedural terminology, whose acronym is CPT, and reminding you that that's a registered trademark of the American Medical Association. So without further ado, let's talk about payment. Now, remember, the payment for the physicians begins with the Medicare Physician Fee Schedule final rule. So many people say to me, Kathleen, what exactly is in the final rule? Well, the final rule always tells us any changes that are going to be made in the guidelines that establish those payment rates. And this final rule for 2026 is over 2,000 pages long, and there actually are many changes, but there's 4 major big categories. And the first one talks about the payment rules that will change for various categories of services, procedures, and products. For example, there are changes in telehealth payment. There are changes in global surgical services. There's changes in payment for chronic illness and behavioral health needs. There's changes in the drugs and biologic products that are paid under the Medicare Part B program. There's changes for rural health clinic and federally qualified health center payment. There's changes for the Medicare prescription drug inflation rebate program. And the one you've all been waiting for is the changes for skin substitutes, which is the old term for cellular and/or tissue-based products for skin wounds. So, one big thing is all of these changes, and there are many of them. The second big thing is the conversion factor, because as you know, all of the codes, the HCPC and the CTP codes that represent the services and procedures and products that physicians are paid for, there is a conversion factor that converts the relative value units to dollars. And this year, there are actually 2 conversion factors. For the physicians who are qualifying participants in alternative payment models, they have a conversion factor just for them, and it gives them a higher payment rate. Now, for all of the other physicians who are not participating in alternative payment models, there is another conversion factor, and it is a lower payment rate. Now, the third thing that happens is after those conversion factors are applied, very often CMS makes adjustments, and they have quite a few adjustments to the rates after the conversion factor is applied. And so you will want to look in the final rule for those adjustments. And then, of course, the final rule also has the attached spreadsheet that includes the actual allowable rates for 2026. Many physicians haven't ever really opened the spreadsheet, but those who do find it to be very interesting. And I want you to know there's many components on this big Excel spreadsheet, but four of them are particularly important for the wound and ulcer management physicians and QHPs. The first thing is the spreadsheet shows the relative value units that's assigned to each HCPC and/or CPT code. The second thing is it then shows how those relative value units get the conversion factor applied to them, and then it shows what the national average allowable rate is for each code that represents work you do in two different places. First, there is an allowable rate for non-facilities, such as a physician's office. Now, that rate is usually a higher payment rate. And then the second national average allowable rate is for work that is performed in a facility, and that usually is a lower rate than the rate in the non-facility. The fourth thing that people are very interested in is that on that spreadsheet, you can find the global period that's been assigned to each code. Now, when you go to the Medicare website and you look at the MPFS webpage, you can go to that big Excel spreadsheet and you could search it for whatever code you are interested in, and you will then find this information about these allowable rates, relative value units, and the global period. Or while you're there, you will see that there is an MPFS lookup tool, which is really cool because it allows you to search a single code, a list of codes, or a range of codes. Now, I went to that Excel spreadsheet and I wanted to see what was the difference for the allowable rates for the application of CTPs in 2026 versus what the physicians and QHPs were paid in 2025. You can see by this chart that I basically have on the chart 5 columns. The first column shows you the codes for the application of the CTPs. The second column shows you what the physicians were paid in a non-facility, like their office, in 2025. Then the third column shows what they were paid if they did that same work in a facility in 2025. Then in the fourth column, I show you how that rate changed for non-facilities in 2026, and then how it changes for if the work is done in a facility in 2026. So let's just take a look at one of the codes. The first code, 15271, which is the application of a CTP to a leg. You see that if a physician did that in his office, in the second column in 2025, you will see it says the national average rate was $148.47. But then if you look in the fourth column, you will see that we now know that the national average rate for that particular code has gone up to $157.99. And in fact, all of the codes had an increase in the non-facility side. That is different, though, than in the facility side, because Medicare had made a decision, and in the final rule, they tell us that they are increasing rates for physicians who do the work in their office, but they are decreasing them if they do it in a facility. And that is actually shown very clearly on this table. For example, 15271. When the physician did that work in a facility in 2025, the rate was $81.51. But if they did it in a facility coming in 2026, the rate goes down to $75.15. So that talks about the application of CTPs and what you will be paid in 2026. What about the product? We know that the products, we typically have a different payment for the application and for the product if the physician was the purchaser of the product. So, in the final rule, we find out some very important information. Number one, it reminds us that in 2025, we got paid for the CTPs because we reported them with their HCPCS codes that began with A or Q. And there was a various payments rates assigned to the products because some products, were paid by the average sales price, some were paid by the wholesale acquisition cost, and some were paid based on invoice cost. Now, in 2026, the final rule says yes, we'll still report the HCPCS codes that begin with A or Q. However, there is going to be one rate for all the products. So we will no longer have separate rates for the different brands. And that rate is now, the national average allowable rate is $127.28 per square centimeter. Now there's two exceptions to that. The first exception is if the CTP received their FDA approval through the BLA pathway, which, by the way, we don't have many of those right now, that those products would continue to be paid the average sales price plus 6%. The other exception is, as you may know, in the past, we have never been able to be paid for any type of a CTP that was not in a sheet form. Medicare says they would now allow the the non-sheet forms to be paid. However, you cannot use the application codes for them. And the non-sheet products would be determined if they were covered by the Medicare administrative contractor, and the payment rate would be determined by each Medicare administrative contractor if they cover the product. So that's very important to know because I received a lot of calls, people saying, oh, now the non-sheet products are going to get paid $127.28, and that is not true. Instead, each Medicare contractor is going to determine, number one, if it's covered, and then number two, what they will pay for it. And so I also want to say one last thing to you about this payment system. It is a payment system. Just because there's a code listed on the Excel spreadsheet, and just because there's a payment rate listed on the Excel spreadsheet, does not mean that a service, a procedure, or a product is actually covered. That will be up to the MACs, whether they cover a particular service, procedure, or product, and it will also be very dependent on you, the providers, whether you prove reasonable and necessary and medical necessity in your documentation. Now, before I close, I have been asked, Kathleen, where do you find this information about the 2026 Medicare Physician Fee Schedule final rule or the big Excel spreadsheet that has all the allowable rates? So, for your convenience, I created a handout and it's attached to this episode. And there you will find a list of links that will connect you to those very important documents. I've also been asked if Wound Care Today USA is going to offer any other additional education programs on this particular fee schedule or the one for OPPS. And the answer is yes. I hope that you will register and join Dr. Alton Johnson and me on November 18th, 2025, when we will be on the Wound Care Today USA Learning Live. During that time, we're going to address the CTP strategies for 2026. I'll explain the MPFS payment changes for CTPs. Then Dr. Johnson will take you through real-world DFU cases that feature different CTPs. You'll also gain insights on both the reimbursement landscape and the practical clinical decision making for CTPs. Now, the second thing that I want you to do is watch for Reimbursement Readiness episode 13, because during that episode, I will review the Hospital Outpatient Prospective Payment System, better known as OPPS. I will review the final rule and the various allowable rates and how that is going to impact Medicare payment for CTPs that are applied in the outpatient wound and ulcer management provider-based departments. And with that, I thank you very much for listening and learning about the payment rate for physicians and other qualified healthcare professionals and how it particularly this year affects the CTPs, both their application payment as well as the payment for the product. And I also want to remind you that my reimbursement friends and I are always open to receiving your questions and or suggestions that you have for topics for us to include in future reimbursement readiness programs. You can send those to my email at kathleenschaum@gmail.com. Thank you for listening, and I hope you take this time to get ready for the 2026 Medicare Physician Fee Schedule changes. Thank you.